The Health Minister, Mutahi Kagwe, who says the country is just days away from running out of vaccines entirely. There's about 100,000 shots of the AstraZeneca vaccine left. And at the rate at which Kenya is vaccinating people, within the next 2 or 3 days, they will be completely out. The country is bringing in vaccines from neighboring countries, such as the Democratic Republic of Congo, which doesn't have the capacity to inoculate as many people as quickly because these vaccines are set to expire in June. But then, after that is over, he says, I don't manufacture vaccines, so I can't tell you when we can get more vaccines. And one of the other things he said is that there's a possibility that some Kenyans that received the first shot of the AstraZeneca vaccine might end up getting another vaccine, most likely Johnson & Johnson. But the big concern for the Kenyans here is the fact that wealthy countries have more vaccines than they need, and poorer countries like Kenya have almost nothing. It's all in vaccine nationalism. This is what the Kenyan Health Minister said.
I think that vaccine nationalism is something that has cropped up across the world. And I have two views on this. The first one is that as a continent, we must stop believing that there is anybody out there who is a good Samaritan, a biblical Samaritan, who is just about to come and help us. There's nothing like that. You know, this is a situation where we have seen very clearly it's everyone for himself or for herself and God for us all, clearly. And therefore, going into the future, the local production, local manufacturing of pharmaceutical commodities and products is an absolute must.
The Serum Institute in India, which is supplying the COVAX initiative, this World Health Organization initiative to get vaccines to low and middle income countries, Serum Institute in India said yesterday it might not be shipping vaccines out of the country until later in the year. And what the Kenyans are now saying is that it looks like this is not going to happen. This India situation is so much more complicated that the countries in Africa should be looking to the Johnson & Johnson vaccine that is manufactured in Africa, and COVAX should be funding that instead. Yesterday, the director of the COVAX, of the Oxford Vaccine Group, told British MPs that it would be morally wrong for wealthy countries to begin vaccinating children when people who are in need in many parts of the world, like here in Kenya, adults are yet to be vaccinated. Rosemary.